back. Today we have our Making the Round segment with Infirmary Health's Dr. Jason Determann, a board-certified and fellowship-trained orthopedic surgeon with Gulf Orthopaedics, Infirmary Health's orthopedic specialty clinic. That is a lot.
That is a lot. Thank you, Lenise.
But very important, because we were talking just over the commercial break how important physical activity is. And, you know, watching at home, you're probably thinking, I know that, but do you really?
Right. I mean, the health benefits of exercise are well known, well studied. You know, we get more and more data that comes out that shows that not just do we get reductions in cardiovascular disease and diabetes, but there are true mortality benefits to being active and leading a healthy, active lifestyle, meaning that you can live longer, you can live healthier, you know, free of disease, chronic disability with a more active lifestyle.
And by active, we mean getting in, like say, a walk, and how it doesn't have to be that long.
No, it really doesn't. I mean, the old mantra of 150 minutes a week of vigorous, intense activity has really fallen. There was a recent study out of the UK just recently published. It showed benefits and reductions in mortality with as little as 75 minutes of exercise a week. So, I mean, that translates to 10 to 12 minutes a day of some type of moderately vigorous activities.
Talk to us about what's actually happening in your body as you're going through these movements and why it's so beneficial, because some people will say, well, it hurts, so I can't walk.
Right. Well, as we age, you know, there's natural changes that happen. I mean, we lose muscle mass, we lose endurance. The benefits of exercise are seen in every body system. So they're seen in our cardiovascular system. We see benefits in terms of blood pressure management. We see benefits in terms of glucose sensitivity, or in our diabetics, the insulin resistance. So all these things have a cumulative effect that even when you add the benefits of exercise to reductions in these different chronic diseases, it still doesn't sum the overall benefit that we get from a mortality standpoint. So they all exponentially increase themselves.
And at your facility, what can you do for people who maybe didn't get that advice or didn't practice that advice enough? How can you help them if they are experiencing discomfort?
Well, we hear it every day, you know, that I'd love to be able to go out and walk, but my knee won't let me, or my hip won't let me, or my back hurts when I do this type of activities. Well, we need to develop as a team a game plan to get you back into that healthy, active lifestyle. So that's where, you know, that's where we can come in. You know, if we have a joint, we have a problem that is limiting our ability to participate in that health benefit exercise, will let us help.
All right. Is there anything else you want to add while we have a little time left?
No, I mean, the benefits of exercise are far outweigh any drug, any nutritional change, any medicine that we have and stuff. And so if you can put it in a pill, people are working on it. It would improve survival rates in so many ways. You know, we're part of now a bigger organization, you know, with my practice merging with Gulf Orthopaedics, and so now we encompass both sides of the bay, from Saraland to Tillman's Corner to Fairhope Foley to Bruton, and so really any orthopedic care on this side, that side of the bay, we feel very confident in terms of getting you back into that healthy lifestyle.
Yeah, and again, just to make sure that you are hearing the advice straight from the doc, get that exercise, right? Absolutely.
If you don't do anything else, get your minutes in.
All right. Thank you so much for joining us today.
Thank you, Lenise.